Aloha. The prevalence of disease and the incidence of disease in Hawaii remains low throughout our state, but the ability of our state to reopen is going to be dependent upon our ability to respond quickly and appropriately to any new cases. We've seen over the last couple of weeks that we've been able to keep the case numbers very, very low, lowest in the country, and I am very pleased with that. But we are going to see new cases. We've seen today 4 cases. 2 of those were among family members, not unexpected, and 2 are still under investigation. So there's still a limited community spread, and we are going to see clusters from time to time. But our real strength is going to be being able to identify the cases quickly and the contacts, and of course be able to isolate and quarantine those as we go. But we feel we're in good shape to do that, and it's a good time to start looking at a new normal where we can once again resume inter-island travel.
Our next questions are for Dr. Anderson, DOH. This is from David Corrigan, Big Island Video News. Can you tell us with as much specificity as possible where the latest cases reported on Hawaii Island are located and how they are being investigated?
As we always do, we have to keep much of the information confidential, respecting the privacy of the individuals. Two of the cases were family members, people who had been living with a confirmed case. One case is still under investigation, and I'm not sure exactly where that case is right now. We've had cases recently in Hilo, residents of Hilo, and other places in the Big Island, including the South Kona District. And we've seen cases on Oahu. I think the important thing to remember is that we are seeing sporadic cases in the state, which are probably associated with some community spread. And fortunately, most of those are associated with known clusters, and we can identify pretty much who infected whom in these situations. But everything is limited here, and we believe very much under control. We haven't seen any situations develop like they have on the mainland, where you have hundreds of cases springing up in a community and simply are overwhelmed with the number of cases and aren't able to do the contact tracing and so forth that's necessary. Virtually all the cases are in quarantine and isolated, and we're tracking their condition at least 3 times a day.
Dr. Anderson, follow-up from Ashley Nagaoka. The new Hawaii County cases, are they family members? And also, would you consider this a new cluster? And is it associated with a traveler from Arkansas?
I don't know the specifics on those. It's interesting that at least one of the cases, possibly 2 of the cases, were cases that were identified initially with the antibody testing that is being done, and then were resampled with the PCR test sometime later, and then found to be positive. We have new testing abilities now, but what we're finding is in many cases the antibody tests are showing up false positives. In fact, a large proportion of those are, and occasionally we get false negatives with that new test. Those tests are still under evaluation, and we're looking at them, but as we've seen over the last few weeks, they're not as reliable as everyone hoped they would be, and they're certainly not appropriate for diagnostic purposes. So when we count a case as a confirmed case, it's a case which has been confirmed with a PCR test, the test that virtually all the clinical laboratories are using now for confirmation purposes.